Are you suffering from dizziness? Are you suffering from vertigo or the heaviness in the head? Your head is feeling like imbalanced and disoriented. In your anyone's, in your friends or family, they are having these symptoms. And one more question. You know that in your body there is a sensor. Yes, I'm serious about that. In your body there is a sensor. Yes, you will get all this answer in today's video. So let's start the video. Welcome back to my YouTube channel. This is Dr. Ravi Khamar here. From my clinic, I'm a spine and joint specialist physiotherapist and vestibular rehabilitation specialist physiotherapist. I'm from my clinic, Dubai again. So in today's video, we're going to start the full new video series for the patients with the dizziness and vertigo. This is very long series. We're going to divide it in video by video, so it is very easy to understand that video series. Okay. And as I mentioned just few minutes back, just a few seconds back, you know, in your body there is a sensor. Yes, and I told you I'm going to answer. So answer is now here. Yes, in your body there is a sensor, and that sensor is none of that but your inner ear. There is some structure is sitting inside your ear. It is responsible for the balance, and that is called as a sensory organ. Yes. Now just pause the video and just answer me very frankly. How many of you know that our ear has a sensory organ of the body? If your answer is yes, just pause the video and just comment below the yes. If your answer, if you doesn't know, just today you got to know. If your answer is no, that you didn't have any idea that ear also is your balance organ, that just comment below no. Why? Because we would just want to know that whatever the people they are watching this video, how many of you have a knowledge. According to that, that is my planning to put the complexity of the video. Okay. Now, this video, it is going to be very, very helpful. The patients might be suffering for the dizziness, vertigo, disorientations, imbalance. They go doctor to doctor. Their MRI is normal. Still, they are not feeling comfortable. They are not comfortable in certain atmosphere. If you are suffering from all these problems, just make sure you watch this full video series. Is going to add too much of value. And might be you are not suffering from any of the symptoms, but at the same time, whatever the knowledge and the content I'm just going to explain here, it is too huge. Because if I give you live seminar or something, this is almost around 2 to 3 hours of content, and I'm going to put this content in some videos. So this content, if you search on a Google, usually you're not going to search on a Google, and if you search also, it is too much highly complex medical term, and it is going out of your mind. Okay, so this all knowledge, I put all this knowledge in very, very simple terminology and the language, so it's very easy for anyone to understand. And if you have this knowledge in your future, might be you, might be your friends or family, or any of you know that might be suffering and going doctor to doctor and still they're not having a proper solution, so you can be the helpful for them. So make sure you just watch this video. If you're interested, it's going to be add so much of value and knowledge you're going to get from this knowledge. So as I mentioned, this is the part 1 of this full video series. In this part 1, we're going to discuss about what is the possible symptoms, the major possible symptoms these patients who have a dizziness and vertigo, what symptoms they feel, and what are the possible causes of these symptoms. In the causes also we are going to discuss in a minor and major causes. So the content of this today's video, as you can see over the screen, first we are going to discuss what is the role of your ear as a balance organ, what is the possible symptoms this patient usually feels, the major symptoms, and what are the possible causes. So in the causes also, what is the major causes and what are the minor causes. So that way we are going to discuss in the depth. So let's start to understand the function of the ear. Let me ask you, how many of you just observe, if you're taking any video from your mobile and if you move your mobile very fast, sometimes that video is not clear and it becomes hazy. Okay, this experience you must have. And if you buy cheaper phones, sometimes the video quality or when you take moving video, it is not clear. Now if you know, if you're a techie guy, you might be knowing there is stabilizer. is coming in the mobile, which is stabilizing the image. The same way your ear is also functioning that way to stabilize your image. Have you ever imagined that if you move very fast like this also, still your image is not like stabilized, your image is very clear, but at the same time, even like costly by costly iPhone if you buy, and if you move your camera very fast, the image is blurry, or might be the image quality is not stabilized. So you can understand whatever the God has given, that is the natural stabilizer, our sensory organ and our balance organ, its ear. That is the main functions to stabilize whatever the image or things we are looking after that. So that is a very strong camera and stabilizer. Already God has gifted us. This is 1000 times powerful than any other good mobile like iPhone. So let's understand what is the function of the ear. Let me ask you one question. That how many of the people they know what is the main function of the ear? So most of the people they say the main function of the ear is listening. But let me tell you, my dear friends, other than listening, there is also very important function of the ear, that is the balance and stabilizing of any things what we see. That is the most important function of the ear, and that's why I told you in our body there is a sensor, and this is the sensor of your body, ear organ, that is the balance organ. So if you don't have this proper organ, or might be if you feel there is a problem in the ear, that time you find this vertigo and dizziness, and that's why people they have the problem or pathology of the ear, they usually feel this kind of a problem. Now let's understand what are the possible symptoms, the major possible symptoms this kind of patient usually feel. So if I talk about the symptoms, the major symptoms, the first symptom, itself we just make this video series name, the vertigo. So that is the major symptoms of all these patients, they feel vertigo. The second symptoms they usually feel the dizziness, the feeling of dizziness. This is the second symptoms. The third symptoms, the usually patient feels that sometimes these patients when they have acute attack or the patient have too much heavy symptoms, they feel nausea and vomiting. Yes, nausea means you feel like vomiting but you will not vomit. So these symptoms usually comes when you have the ear related problem or vertigo. The fourth symptoms, these patients usually feels imbalance also. So these patients when they walk or might be when they move their head, they feel like their body something is not stable and they are moving something like that. So these symptoms is also coming from that. After that, usually these patients feel the motion sickness and swelling, and this is the all symptoms. And apart from the last symptoms, some of the patients they also feel disorientation from their surrounding. So these all symptoms, let's understand in the depth. The first symptoms, that is a vertigo. So vertigo, usually the patient feels like this is the part of the acute attack. So when there is a vertigo, that means the patient is actually having a very recent attack, and in this case they should take very emergency medical care. They should meet any ENT specialist or might be the specialist physiotherapist who treat the patient with the vertigo. In vertigo, the patient feels they are sitting just simply, but still their surrounding is rotating towards them, and they feel like too much like giddiness and all these symptoms. So this is the acute attack, and this is symptoms is considered as a vertigo. The next symptoms, that is a dizziness. So dizziness means is low level of vertigo, but at the same time it is a little bit mixed in between vertigo and dizziness. So let me tell you what is the basic difference. So vertigo is very heavy symptoms of rotational effect, whereas the dizziness means not feeling something is normal. Suppose the patient is moving their head like that, and they feel something is little bit more movement, but not that much heavy like vertigo. Or might be they are not feeling something like a normal person. That is called as a dizziness. Now let's come to our third symptoms, the nausea and vomiting. Yes, so patients who has ear related, specifically the ear related vertigo and dizziness symptoms in the very acute and heavy attack, that is vomiting sensation and there is a nausea. What is considerable, like if you have these symptoms, that means your symptom is very high and you need very emergency medical care. So I advise any patients they feel this kind of symptoms, they should meet any ENT specialist or the specialist, vestibular dizziness specialist, physiotherapist. Okay. Apart from that, there is also the next symptoms the patient usually feels. There is a swelling. Swelling means, like suppose
I'm sitting just normally like that, and I feel like my body is in the waves, and might be like you feel like in the water. In the water, which kind of symptoms usually feel? This kind of symptoms the patient usually feels. This is called as a swaying. Okay, and motion sickness. What does it mean by motion sickness? Sickness, what itself is sickness, and motion. So the patient who's having a motion, they're not able to understand the intensity, frequency, and the power of the motion. So let me just give you the example. Suppose a patient who's having this motion sickness symptoms, they are actually traveling the car, bus, or the flight. So they are not usually comfortable, or they feel too much problem, they feel nausea and vomiting, and sometimes also they feel some kind of the sweating in the hands. So they are not comfortable with the motion. It might be the car is going at the speed of 50 km per hour, but they consider this is going at 150 km per hour, or might be they feel it is going at 20 km per hour. So you can understand, they are not able to exactly identify what is the level of motion is going on. So that is called as a motion sickness. And let me give you another example for motion sickness. Might be the patient feels when they are in the lift, they are actually not comfortable, or might be they are in the boat or the ship. When the ship is a little bit moving, they are not feeling comfortable. This all the symptom is coming under category of the motion sickness. And now let's talk about the imbalance. So as I mentioned, imbalance means the patient usually feels like when they are moving, they are walking, their balance is not okay. They feel something is not right, and they feel not able to balance themselves. They need to hold something. So these all symptoms comes under imbalance. And the last symptom, that is called as a disorientation. So disorientation, usually patient feels like they are not oriented towards the surrounding. They are not feeling normal. They feel their head is like heavy, and they are not feel like something is right. Even they are moving their head, they feel something is bothering them. But it is not vertigo, but it's something is not right. These all symptoms come as a disorientation. So these all the symptoms usually patients with this kind of the problem they usually have. Now let's discuss about what is the possible major causes.
So in the causes wise, what might be the possible causes for all the symptoms? So in this one, we're going to make this category, the major causes and the minor causes. So in the major causes, we're going to understand that is the two causes major. First, if you have all the symptoms, the main cause is ear-related problem, and the second, the major causes is most of the people they doesn't know. Yes, when you have a neck pain or neck problem, that can also cause the dizziness and vertigo. So as I mentioned, the ear-related part we're going to discuss in depth in our next video, because if we are going to make you understand everything in one video, it is very difficult. So we're going to discuss very much depth about which kind of the symptoms ear-related vertigo patients have in depth. Okay. Now let's talk about the minor symptoms. So in the minor symptoms, first of all, the minor symptom is the blood pressure. If you have a blood pressure problem and your blood pressure is going down, okay, so that patient usually feel disorientation, and sometimes they also feel like imbalance. So these patients, what they can do, if they have any problem with the blood pressure, so just drink a lot of water, and if you are taking any tablets with the blood pressure, if you skip 2 to 3 days, just take that tablet and you will might be fine. So might be your problem related to blood pressure. Okay. And if you are not okay with that, then you should make sure to consider to meet some consultation or to meet some doctor. After that, very important causes, that is the sleep. Yes, nowadays due to too much heavy work in front of the computer, in front of the screen, so there is a blue light coming from all the screen and all this mobile screen. So this blue light is considered to disturb your sleep cycle. And I have observed all of my patients, almost 70 to 80% of all of the patients, they have a dizziness and vertigo. That the root cause is lack of proper sleep. And they are not sleeping early. They are usually very late. They usually sleep, and that's why if this kind of lifestyles continue for 4 to 5 years, this kind of patient usually increase the tendency to get vertigo and dizziness that is from the ear origin. So make sure if you're not sleeping well, just sleep well, at least 7 to 8 hours of night sleep, and from 11 p.m. to 7 p.m. Okay. The next possible causes is a migraine and headache. Some of the patients,
when they have a migraine and a very severe attack of the headache, this patient also sometimes usually feels vertigo and dizziness. So that's totally fine. You have to take your normal medications, what you are taking for the migraines and for the headache. And now let's go to our next one that is very important, and that is the stress. Yes, we all suffer with the stress. Nowadays in our modern society, there is a lot of stress. Okay, and this stress is coming because of very minor reasons. So what I advise, if you are having a stress or something, just relax yourself, sleep well, and automatically think good, you will feel out of the stress. And the last one, that is neurological causes. In neurological causes, might be sometimes patient have a head injury. So what happened? The part which is controlling your ear related function, which is totally damaged. The part which is controlling your balance, that is the part is here. That's why usually we usually call it Hindi, यहाँ पे छोटा दिमाग होता है, उसको मत मारो. This छोटा दिमाग is responsible for the balance. So this part is injured or something, that kind of the patient usually feel imbalance also. Now apart from that, some patient having the stroke, there is no blood artery rupture in the brain. So this stroke might be if in the part near to the balance area. This usually also patients usually feel vertigo, dizziness and disorientation and imbalance. So I hope now it's very clear. So what are the possible causes and you have a clear idea. So now in our next video, we're going to discuss more about the depth of what is the ear related particular pathology and how this ear related problem and dizziness and vertigo usually happens. Just to summarize this full video, let me tell you, this full video we discuss majorly in the 3 ways. I'm just summarizing for you what is the basic function of the ear, the possible symptoms and what is the possible causes. Just to summarize. So if you feel this video actually giving you so much of information to you that you might not know, or if you feel this video, this content of this video might be helpful in your friends or family who might be suffering with this kind of the problem, please make sure to share this video to them so indirectly you can help them. Apart from that, if you're new to this channel, if you're new to my YouTube channel, make sure you watch our introduction video so you have idea this channel is all about what. And also if you feel this adding so much of value in your life, make sure to like this video and subscribe to the channel and hit the bell icon so in the future you will get all the notifications. If you feel in your friends or family someone is still suffering and they want to consult me personally, so you can book our online free consultation. You can see the number on the screen, that is our WhatsApp number. You can just ping the hi there, so we will just explain you all the procedure how you can take our online free consultation. So with that, we'll see you in our next video. To understand the future video, just make sure you watch all this video. It's going to give so much of impactful knowledge. So in our next video, we're going to discuss in the depth about the ear related dizziness and vertigo. So let's see you in our next video. Till then, bye bye, take care.